Okay, so this is about the retina. The retina is the back of the eye. It's the film in the camera, right? It's very, very, very important structure because there are many, many conditions that are potentially blinding that are associated with the retina. So this talk is about computer-assisted analysis and screening, diagnostic of retinal images, okay? There are many, many types of retinal images. I'm going to concentrate this talk on one type of retinal image, which is the most common and most accessible by far, okay, which is the color fundus image or the color retinal image, okay? There are other things, and there are many other talks that we can, Dr. Saad worked with me, and Will Rogers is here. He worked with me on this summer, and he's going to do a quick part of the presentation, and I'll try to give him the time. Okay, and here are some credits again. And here's the abstract, so let me tell you the story. Basically, that's where the retina is, in the back of the eye. And there are a lot of, when we talk about technicalities, there are a lot of contrasts. So we're going to talk about normal and abnormal. Okay. It's still very important to detect normal images. Okay, I want to be able to detect normal images, at least to say, oh, this is normal, right? There, in terms of technical acquisition, there are devices that allow you to get a picture of the retina without dilating the eye, putting these little drops that make your pupil huge. Okay, so it's an undilated or non-mydriatic exam. That's the technical term. So that's an example of a normal, undilated right eye. So it's undilated in the sense that the device that acquired this image that did not require you to put drops and make the pupil huge. Okay? And that's nice. It's nice that we have some of these devices, and we'll see how that goes. Now, this is an example of a dilated right eye, okay, and it's diabetic. Okay? There are signs of diabetes on this. The lights are a little bright to see everything, but you can see this little yellow here, which is not at all normal, okay, and you can see a whole bunch of little dots, and there's kind of a little blood that's not supposed to be there, right? And if you look very, very carefully, and if we dim the lights, can anybody dim the lights in under 20 seconds? Try. One more. Shut them off if you can. No? Yeah. Okay, so I had a radiology professor, and she used to tell us, hallucinate with me. Okay? So hallucinate with me and look down here and tell me if you see anything. So this is like this brown, yellow little dots. Okay. So these are actually laser spots. This eye has been lasered, and it has been lasered because it has diabetes, right? So anyway, so these are lots of things, little things that I'd like to pick up when I have, so this tells me that yes, it has diabetes. Yes, it's very close to the center of the vision, so this eye is in danger, okay? It does have, some blood bleeding here and so on. And, well, maybe it's a good sign. It has already been treated. Maybe 2 years ago, maybe, I don't know when. But not yesterday. So you have all these things that you may want to pick up. Okay, so more examples of the bad things that can go on with diabetic eyes. And this is labeled now. So this kind of labeling is sort of what I'd like to get. So I'd like to get the raw image, start with the raw image, and then have some automated system that gives me all of this. All right? So it tells me, and these are just technical names for these things, and then I can. So that's an example of macular degeneration. Okay, the other disease that's very, very important, very common, blinding, is glaucoma. And glaucoma usually has to do with the optic disc, the optic nerve, and this is the front part of the optic nerve where at the eye, you can see it in the eye. The eye is the only place where you can see your arteries and veins. It's the only place where you can see your central nervous system, right? You actually see the nerve. Here it is. So if it's whitish like this, lots of glaucoma. If it gets completely white, it's very severe glaucoma. So it's pretty easy to detect, right? I mean, you can teach someone to at least get a feel for this. So we want also the machines to do some of that. The good news is that now we have more and more portable devices, right? So look, this is a device that will acquire some pretty good quality images. And we took this a couple of days ago at the big meeting in Chicago. And the screening is very accessible. You can use this device, you can go to the patient's home, you can have a nurse or a technician acquire these images, okay? And guess what? Even the doctors can do it, okay? So that's good news. Here's an example of this Visual Scout. This is a Zeiss system, the one I was just showing you. And you take the picture, and guess what? You have this big abnormal lesion here, which happens to be toxoplasmosis, but it doesn't matter what it is. But it is a lesion, and it's very close to the center, but it's not in the center. So this patient will still have good vision. They may have a little field loss here, but you want to know these things, and you want to detect it. Okay, so you can do screening by human readers, and this is an actual system. And so you can bring these pictures here, and then you have a little input form, okay, that would tell you, okay, do you have microaneurysms? Do you have like yellow stuff? Do you have red stuff? Do you have this? How much? Right eye, left eye? And then you can rate the quality of the image, and then you can submit this for evaluation, okay? So that's not automated, but it's human guided or. Okay, this is a system that I've developed a long time ago, not very long. It's after Thomas Young, I guess. But so this system is based on it's a database system, and what it has is a collection of the retinal diseases, not all. So it was called the Queryable Atlas of the Retina. And it has acquired a new name that was coined by Jessica Tybell, RetinASK. And basically, for each condition, let's say diabetic condition, let's say macular degeneration, let's say there's some weird conditions that have names like Stargardt, many different things. You don't need to know that, but there are many of these. Dozens, maybe hundreds, and you have a little sheet that describes them, okay? And you put this in a database, okay? The database includes, for example, the age or the age range. It includes the laterality. Is it something that affects one eye or both eyes? It includes like preferential conditions for, say, male or female, and so on. And then you put this in an Access database, and then you can interrogate it or query it. So you can put filters. So let's say like a 36-year-old woman walks in the clinic and complains that her left eye sees much worse than 2 weeks ago, and it was a gradual onset. So you have several elements that you can put in here with filters. She's not 2 years old. She's not 80 years old. It's a she. It's one eye that's affected, and so on and so forth. If you put this in, it's going to filter all of the other things that don't apply, and it will come up with a short, hopefully short, and diagnosis or list of possible diagnoses, and it will pull that. Now, this had images in it, but the images were not used to query, okay? The images were for illustration. So you pull with the text, okay, and then you look, and then you ask yourself, is this similar to what I'm seeing in this person's eyes, okay? Now, the other component is this ARIA, automatic retinal image analysis. Okay, which is sort of the other side, the other pole of this equation. So what you want to do is to look at an image and extract from it all of these features that I was talking to you about, like when we looked at the diabetic patients, like the bleeding, the yellow spots, how close they are to the center, or if you're doing the glaucoma, the optic disc, and so on and so forth. So there's a whole history here of this field. It's a fairly young field, and I'm not going to do too much of this because I want to give Will some time. But the uses are obvious, or maybe not so obvious. One of them is screening. Well, if someone comes in and they are, I don't know, 8,000 miles from my clinic, and I don't have a specialist in retina to really tell them what's going on and whatnot, I want to at least know, and let's say they're diabetic, I want to at least know, are they in trouble or not, right? And maybe they're not in trouble at all. Maybe they're fine. Maybe we can see them in 5 years, right? So you want to do this screening. You don't need a very exact diagnosis or very exact, but you want to do screening. Now, of course, diabetic retinopathy is a huge issue now all over the world, okay? Places in the world where people used to starve to death have exactly the opposite problem now. Everybody's getting huge and eating 8 times more than they should and acquiring diabetes sometimes in their first decade, right, of life. So that's going to be a huge. So you want a computer-assisted diagnosis and risk stratification, very important. You want to do longitudinal studies, or you want to even follow your patients today, in 1 year, in 5 years. You want to see how things are and then compare. And you may want to be looking at some kind of image-guided surgery for some applications. Okay, so telehealth is very important, and there are examples of that. Optic disc detection method. Just as an example, this is an example, is from a paper, a very recent paper. It shows all of the methods that have been used and with the degree of success. I'm listing some of the techniques here that have been used by different, everybody uses a slightly different method, and they have reasonable success and so on. My main point from the slide is that, first of all, there are some standardized data sets on which you can try your own algorithm if you come up with something. And the other one is that most of this functionality that everybody is doing, different implementation, whatever language they're using, all of this is really available in Mathematica, right? So you can house this whole structure in a Mathematica framework. And like Shadi was saying, okay, we have all of this audio and imaging, and it's very nice, and there's all these new features in Mathematica 11. But okay, one huge thing is that they're all sitting in Mathematica, and you can use this whole functionality. So you can take this audio file and say, my audio file plus 2 divided by 7, right? Or whatever other. Okay, so here is an example of Mathematica image analysis. What we're trying to do here is tell where the arteries and the veins are. And this was a very simple function. So Will is going to come and show you a couple of things he has worked on. And I'm going to give him 5 minutes. And then I'll conclude in 5 minutes. And it'll be the most amazing talk of the whole conference because we'll be on time. So, Will, you can put this in your pocket, this or that, whichever. So Will worked with me this summer and continues to work on this. He's in high school here in town.
All right. So here we have, what we're trying to do is this. We're trying to find the optic disc inside the picture of the retina. And to do that, one of the methods I developed was a kind of sliding window. So you kind of look at all the possible places the optic disc could be in the eye, and then try and figure out which one of those has the optic disc. One way we can do that is if we look at the picture, the optic disc is one of the brightest places in the eye. So we can narrow it down pretty quickly and then try and identify which of the brightest places is the optic disc. So that's one way to find optic discs. And then we also, you did do the vein detection is another method we're showing, which is this, which we saw earlier. So we're highlighting the veins in the eye, which can be important to know like what the structure of the vein is for identifying certain diseases that might be affecting your eye. And to do that, we use GradientFilter, which is one of the functions available in Mathematica, which is almost like a derivative, kind of, in mathematics, where it will tell you what the change is in the brightness. So you take one pixel and compare it to the brightness of the area around it and see what the change is. And then it creates a new image with each pixel being the change of the brightness in the area, from the area around it. So if we clean this up and then overlay the picture, we can get an outline of the veins of the eye. All right, and is Samir going to wrap it up, or am I?
Yeah, I'll.
All right.
Yeah, just give me the next slide.
All right.
Yeah, and stay here because they have questions for you.
All right.
Here, I'll just borrow this. Thank you. Yeah, you can sit and be available. Okay, so I'll just wrap up this by saying that what we are in the process of doing is to integrate this area of automated diagnosis, like pulling from the images to the database system that we had already developed. And of course, it needs further development too as we make this fusion or this interface, and also as we have more imaging modalities that become available to us. One example, I told you that the RetinASK was developed a little bit before 2000 and was presented in 2000. Now after this, there's a technique called optical coherence tomography, which is a very sophisticated technique, tells us a lot about the retina and a lot about diabetic retina, a lot about macular degeneration and so on. So definitely you want to integrate this. Of course, it becomes more expensive. You have this whole more complex and whatnot. So you want to balance things and decide what kind of system you want to develop. But again, just in the integration process. So in conclusion, RetinASK is a text/numeric-based system. ARIA generates text and numbers from images. So you can take the image, generate the text and the descriptions and some numbers, and then you can feed this into RetinASK. So RetinASK then screens, classifies, diagnoses. You have many semi-quantitative criteria in ophthalmology. So when we classify things, we say, especially when you do studies, so you say, well, is this little yellow dot closer than 500 micron or further than 500 micron from the center of the retina, for example, right? So there are things like this. So this is kind of a natural place to do this kind of analysis. Now, of course, a lot like Stephen was saying yesterday, he's very interested in computational X. X being anything from anthropology to zoology, right? So there are journals of computational biology, for example, right? And so on and so forth. But so there are some fields that haven't yet added the label computational. Okay, so this is a natural place to add the label computational because we do things quantitatively already. An example is the clinically significant diabetic retinal edema that is potentially blinding. And it also, that classification will give you useful information such as the need for treatment, okay? So it's very important to get a good screening and diagnostic tool. So I'm gonna stop here to give an opportunity for people to ask questions. You can ask me, you can ask Will, and then we'll also not interfere with the next talk in this room. Thank you.